I know what it's like to start your singing practice and you go like, huh? And then you feel like you're either choking on your voice or like, Jesus, I was able to hit these notes last week. Where on earth did they go today? Or you start doing your warm-up and you just feel so unstable. You feel like your voice is not sitting very well. You just feel like, bleh. And then I'd like to ask you a couple of questions about what is going on with your hormones. This could be a really big reason why you're feeling unstable in your voice, why you feel like it gets dry, why you feel like you choke on some notes, that you can't get higher in your range, your pitching goes to shit. In this video, I'm going to take you through some of the main reasons that hormones could be wrecking your voice and how you can, well, what you can do to help mitigate that, but also what I do with my students in the studio to help them navigate these changes that are happening. So let's get straight to the video. Kia ora and welcome. My name is Zoe Stibi and I have been a vocal coach of women for over 18 years. I have been teaching some of them for up to 12 years. Yes, I have had the absolute pleasure and the honor of helping them navigate these hormonal changes that are going on in their voices, and also through my own hormonal changes as a woman. And also at the other side with some of my older students as well, what's going on there with their voices. This is just such a wonderful topic because I feel like it's not really spoken about, the differences that different sections of our hormonal lives and what they do for us, or what they can, it feels like sometimes they can ruin for us. And I know that sometimes a lot of my students say like, oh, it's like the worst thing to be a woman. And I want to help you navigate that because it really isn't, and you can use these as your strengths. And also when they're happening, you can kind of like work around them a little bit. So let's just get straight to number one. I feel like this is just going to go chronologically. I feel like this is just the easiest. So we're just going to start at the very beginning, a very good place to start. And we're going to start with young girls entering into puberty. Now, I don't know about you, but all women have been through, or all women who have been through this are going to feel the utmost sympathy for you young girls who are either going into puberty or experiencing it at the moment. It is probably one of the most tumultuous times of your life where you're being flooded with hormones. All sorts of stuff is going on, but we're here to talk specifically about your voice. Now, I don't know about you, but personally, I was 10 years old when I started going through puberty, and I do know that the age is getting even younger, with some girls going through puberty at 8 or 9 years old. So you've had all these beautiful high notes, everything's been singing song, you're defying gravity in the original key, and then all of a sudden there's a big whack and you feel like your high notes disappear. Totally normal when it comes through going through these hormonal changes. What happens is when the hormones start to, run their course within our bodies at the start of the phase of puberty, our vocal folds, well, we not only hold on to a little bit more water than usual. Water retention is one of the causes, is one of the side effects of these hormones. And that retention can also lead to water retention in our vocal folds themselves, which firstly, it causes difficulty with reaching high notes. It can also feel like a little bit sluggish, feel like you really hit a ceiling, feel like notes that were there before suddenly aren't there anymore. And this can often, most of the time, it's contributed to going through puberty. But don't worry, through singing training, we can help you to navigate some of these things that are going on. It's also said that over puberty in that phase, you're also growing. So the larynx in a female will also grow. We just doesn't quite grow as much as the boys. So the female voice change is often not talked about, and that very first one can lead to quite a substantial darkening of the voice in some singers. So don't be worried if all of a sudden you start sounding a little bit deeper. You'll get another drop in your pitch around 18, 19, and then another one as you're sort of reaching about 22, 23. Now, this is purely what I have experienced with singers in my vocal studio, as well as in my own voice, and anecdotal evidence of talking to my fellow singing teacher colleagues, But basically, as we get older, the larynx starts to drop due to gravity, and also, but that first kind of dropping is due to the larynx actually growing in size. It has to also be said that around this time is usually when young girls are getting braces, and braces can cause quite a lot of tension in the head and the neck region. That pulling on the teeth is also going to make it very, very difficult to reach high notes or to sing louder. So if you were someone who was belting clear as a whistle beforehand and now you really struggle, I want you to think what's going on in with your period and your cycle, and then also, have you suddenly gotten braces, suddenly had plates put in, or is anything going on here in the teeth region? Because that will also have a big impact on your singing voice. Again, this will sort itself out in the long run through vocal training, keeping on singing, and also adjusting the keys of your songs, because we don't want you to be straining up here the whole time. I want you to take the keys of your songs down low and switch into a slightly lighter voice quality as you're going high up in the range. Don't try and push the belt during this time. And I really want you to think about getting the vocal folds as thin as possible and getting that sound as quiet as possible. Because if we start working at that more difficult section of the range, which is often singing quieter when we've got slightly not so optimal vocal fold closure, then it's going to really help you in the long run with your vocal training. So number 2, then we have the period itself. Then sort of as we've come out of the puberty phase and now we've started to have regular periods, again, this increase in the hormones over the course of our monthly phase can cause water retention and the retention of these fluids inside the vocal folds themselves, making high notes and singing loudly much, much more difficult than usual. There haven't been a lot of studies done on the female singing voice and the effect of the menstrual cycle, but in the few that have been done, they have noticed that this change in the voice is largely before the period itself, so before that bleeding phase begins. I know I'm not using all of the technical terms, but anyway, before you get your period, it's usually in those couple of days beforehand. This is actually called, I'm going to read this because it's a big Latin word. It's called dysphonia premenstrualis, which makes sense. And I'm just going to read these symptoms because they do come directly from the paper itself. Symptoms of dysphonia premenstrualis include decreased vocal efficiency, so it feels more difficult than usual. Reduced flexibility, so you might feel like your riffs and runs are a little bit sluggish or slow. We also notice breathiness, which is what we were talking about with the swelling of the vocal folds. They're not quite touching. And so those little areas where they're not touching means that breath comes through. So we feel like we've got this increase in breath. Fatigue. Any woman who has had their period knows that they get quite tired. And so really these teeny tiny muscles of the larynx will also get tired, like your general body. Loss of high notes. That's usually due to the increase in the fluid on the vocal folds, and that swelling can really cause us to have a really terrible time with our high notes. Hoarseness due to a dryness that can occur within the throat itself, and believe it or not, ladies, actually intonation issues. Personally, I sing quite flat when I have my period. And I actually have singers where we have to cancel their singing lessons. We have to plan them in based around their cycle because they can sing up to half a step below where we should be singing during this phase of their cycle. So it's nothing to worry about. It's totally normal. And I just want you to know that you can work around these things. So that could be, again, moving your singing lessons to fit your cycle, which I really recommend that you do if you do experience really strong symptoms. I'd also suggest that you look at introducing a little bit of twang, that into your voice, because twang is going to help to bring those vocal folds together, which is going to mitigate a little bit of that swelling. I would also recommend that you swap to a lighter voice quality. So if you're suffering from vocal fatigue, we want to kind of work around that belt. And so we're looking to then change to maybe a higher chest voice with a little bit of twang. I think I'll try, rather than a full-on belted sound, because that's, again, a little bit of that weight is going to reduce that vocal, or the effects of the vocal fatigue on the voice. I think just during this time, it happens every single month, and we know this, and it might be irregular for you, and that's absolutely fine. That's just the beauty of the human body. So rather than being like, oh, it's so terrible, beating yourself up about it, treat yourself with kindness. Drink a nice cup of warm tea, because we do know that can mitigate, using the placebo effect, mitigate some of those feelings of hoarseness or dryness within the throat. And change the key of your songs, and then switch to songs that you find a little bit easier for your voice. You can still train, you can still sing, but just maybe keeping note of where you are in your cycle and what that's actually doing to your sound they're producing. So I know it can sometimes feel like, before we get our period, what do you mean, Zoe? Like every single month I need to do this? And basically. I want you to take note, maybe in a practice diary, or on your calendar, and have a look at what's really going on within your cycle and what symptoms you're experiencing in your voice. Because, for example, if you're experiencing dryness, you can grab some throat lozenges during this time. Or grab yourself a cup of tea, because that can, through the placebo effect, help with those feelings of dryness. We can also experience that the voice becomes a little bit unstable. So maybe we need to warm up our bodies with some shoulder rolls or some big stretches while we're doing our vocalizations. It could also mean that you need to do a slightly more in-depth warm-up, looking at the vocal fold closure specifically before the onset of the tone. I've actually got my favorite vocal warm-up for you down in the description below for you to download. Although it is incredibly challenging, and I will admit it can get a little bit annoying because it's like, why is this so hard? But it is my absolute go-to warm-up every single time I want to warm up my voice to sing higher or even louder in my range. And it just warms up absolutely everything before starting singing. Number 3, during the period itself, or in this 5 to 7 days of menstruation. Now, absolutely everybody can experience a range of symptoms, but some of the main symptoms being pain, uncomfortableness, cramps, bloating, and feeling of pressure in the lower abdomen region. I, for example, experience quite a lot of pain in my lower back. And so what we're experiencing there is, with pain comes tension. And so where, for example, if I get you to hold onto your fist and press it really, really tightly, I've got the tension there, which builds up through pain. Pain in the body will then cause tension, because our body is trying to hold on to that position to stop the pain from occurring. So that tension is then, I can feel it now reaching here, 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 here. And as I get stronger, you can see now here, this is affecting the muscles in my head and my neck. So as much as we don't want this to happen, pain anywhere in the body will usually lead to a little bit of tension, unwanted, of course, in the head and the neck region. So you can mitigate this by using warmth. So I, for example, have a warm kind of bean bag that I put here on my head and my neck region, on my lower back. Of course, you can use painkillers. Now, the only thing that I would say to be careful with painkillers is, please speak to your medical professional about which painkillers you should be taking. Because, for example, we do not recommend that you take aspirin when you are singing, because that thins the blood, and through that thinning there can be an increased risk of hemorrhaging at the vocal fold level. I'm not saying that it's a definite. I took aspirin without knowing this for years and years and years, and nothing happened. but we do not recommend singing and taking aspirin at the same time. So please do seek medical guidance on which ones are the best for you. Just as well with muscle relaxants, Buscopan, for example, is a really common one. We just want to be taking note of what the effects will be on the voice, because the idea is that those are not they're not going to just target your period pain. They're going to relax all of the muscles in the body, and so that can sometimes make it more difficult for you to sing, with a sort of feeling of not being able to activate the support muscles that you're usually wanting to activate. Now, through my many years as a vocal coach, I of course can almost always hear when a singer has their period. And it sometimes can just be much easier if you just come into your singing lessons and just say, hey, Zoe, full disclosure, I've got my period. Firstly, it's really important to know that there's nothing strange or weird or gross, and you shouldn't feel embarrassed about that whatsoever. And honestly, your vocal coach, we will always be able to hear it if we've been working with you for longer than, say, 3 or 4 months. We will notice that there is a difference in your voice. Now, some of the things that we notice is the voice starts to become a little bit less stable. There's a sort of fragility in the tone. It can sort of sometimes break away a little bit, like sort of wanting to flip into that head voice register without really us wanting to. Pitches in the higher part of the range that would usually sit absolutely perfectly can sometimes become much more difficult. And sometimes the tone can feel a little bit more strangled or tightened. I also notice that singers sometimes have a little bit of struggle with their pitching and sit a little bit under the note. But in general, there's quite a lot of instability within the voice. So quite like in the area, in the couple of days we talked about with the dysphonia premenstrualis, it can also happen during that menstruation time as well. So it's not really like no one is the same, but we really can hear that time in the voice. And obviously there is a noticeable amount of fatigue going on in the body. And so we're going to be hearing that as well in the sound. So the ways that you can mitigate this, like I talked about with the time before your period, I want you to adjust the key of your songs. I want you to also adjust your expectations. During this time, we're not going to be looking to belt or to increase our belt in the highest of the range. But what we are going to be looking to do is to increase stability in the sounds that we are able to reach at a comfortable level within the voice. So maybe you need to work a little bit more in the body. I like to tell students to reach up tall and to use movement as a way of releasing that tension within the body that may be coming from that pain or discomfort. And like I said, with keeping note of your cycle, I've had students who have had such debilitating pain that they are unable to stand for long periods of time. So I beg you, lovely ladies, you women out there who are experiencing that level of discomfort, please, please, please cancel your singing lessons or move them. Your teacher will be, as long as you give us, enough notice, we are more than happy to accommodate for these things, because there's nothing more awful for us to see as well when you're standing there sort of almost bent over in pain. I want you to know that, we understand what's going on, we feel you, and we want to make sure that we're doing what's best for your voice. And if you're having extreme pain, or I know that some women also experience illness and they need to throw up during this period of time, I definitely want you to move your singing lessons, because it makes no sense when you're in that much pain for you to perform. Well, for you to be in your singing lesson. Number 4. Now, as we've gone through the puberty, we've gone through, at the beginning of our period, during our period, and now we have our birth control. So this is the hormonal birth control I'm going to be talking about. And please, there are really no studies that have been done on the effects of hormonal birth control on the singer's voice. But obviously, due to anecdotal evidence, we singers, we talk to each other about these things. We're like, oh, goodness me, I tried this and it ended up flipping away. My voice felt a little bit frail, fragile. The symptoms are quite similar, but I really do encourage you to keep a practice diary of your voice and to notice when these things come up. So obviously, birth control, we notice, yes, sometimes when you go on it, not for everybody, not everybody experiences these symptoms, but we really do hear a general fragility and instability in the sound, and it's very specific to the voice kind of breaking away. It's like this where you sort of have that almost double tone. We really hear it in that sort of like mid, over the passaggio into the head voice and up into that upper register. We start hearing a thinness to the sound. Now, this can be due to the levels of, the different levels of hormones within the body. Obviously, there are different types of hormonal pills that you can take. And please, I'm not trying to say which one. You really do need to speak to a medical professional about these things, but also speak to them about the fact that your voice is very important to you and you are noticing these symptoms happening within your voice. Also, start the discussion with your singing teacher and say, hey, I've decided to go on the pill. Can you just keep an eye out for what's going on with my voice and what's going to be, happening? Because we can also support you in that area with choosing the right one to fit your voice. I've noticed with students, I can sort of tell about 2 months after they've begun, I start to notice what's going on with the voice. And then I just simply ask them if they have started to take the hormonal contraceptive pill. And usually you can hear it pretty clearly. So this would just mean that you would either continue with those things that are happening to your voice and be absolutely fine with it, or we would suggest that you would try a different one and see if it had the same effects. And I was on the pill for 16 years. I'm not saying that it's bad. I'm also not promoting it. I just wanted to let you know that as a professional singer, I did take it for a very long period of time, and I eventually found a pill that worked absolutely fine for my voice. So it's definitely not like sing or I'm not going to tell anyone what they should do with their own bodies, but I do really suggest that you speak to a medical professional about that. I feel like I'm repeating myself that, to be honest, but it's really, really important that this doesn't just come from random searches on the internet. I'm just trying to give you an insight into what we hear as vocal coaches, and you really do need to speak to your doctor about which options would suit you best. Before we get to the last one, I know I'm reading this, I'm reading through my script today as well. I'm thinking to myself, my goodness me, this must feel like being a woman is so difficult. And it is. I'm not going to play that down because, some women can experience extreme changes within their voices, and some women can experience very little changes within their voices. But really the way that we mitigate it, and I get this question quite a lot, bloody hell, Zoe, what do professional singers do? And really, professional singers learn to mitigate these changes, or they can kind of like fudge around them due to their vocal technique and learning how to work with their voices and making those changes to their sound. And that really only comes through vocal training and really getting to know your voice well, which is why I started the Vocal Academy, which is my online singing school, to teach you how to sing with more stability and security, not only during these phases of your cycle, but also, throughout the year to really feel like you know what's going on within your own body, and you know what changes need to be made within your voice so that you can, not have it necessarily come out, and that you can sing as well as we know you can on other days where these effects aren't taking hold. So check out the link in the description below for the information about my Vocal Academy. I'd love to see you there to help you with your vocal technique. The final point for today, and we're coming out the other end of this wonderful journey of our cycle and hormonal changes, and we have perimenopause and into menopause. Now, it's widely known, hot flushes, forgetfulness, but the effects on the voice are really not often talked about. And it's something that I feel has a lot of stigma attached to it about what happens with the voice. Now, I have had the absolute pleasure, as I say, and I do really feel it a pleasure and such an honor to be able to work with women throughout these different stages in their vocal careers, but also heading into perimenopause and menopause. So some women may not hear any changes whatsoever, but some women may experience rather large changes to their voices. So I am just going to read this little section because it is from a paper that was written by Joanne Bozeman. I will put a link in the description below because she has done a lot of research and was one of the world's leading experts, I would say, on the hormonal changes of perimenopause and menopause on the voice. So I really do recommend her if this is something that you are going through currently, or you're reaching that time in your singing career or in your life where you're thinking like, oh my goodness me, do I need to start thinking about it's something that I think about. I'm reaching 40, so I'm thinking about that as well myself. So some of the side effects or the effects of perimenopause and menopause on the voice can be dry throat, unpredictable voice quality, decreased range. So as we're experiencing these changes on the hormonal landscape that we have, it can cause a stiffening of the vocal folds and less flexibility within the vocal folds themselves, or in that overall covering of the vocal folds. So we have the main ligament, and then we have this like a covering, and so that's where that decreased range would come from. Decrease in volume. So overall, we're experiencing a little bit of instability, but that decrease in volume can often come as quite a surprise to people. Decreased stamina. So that can be caused by a large number of reasons. I mean, obviously it's all to do with hormones, but that's something that people really underestimate, is this change in stamina feeling with the voice. Fatigue has been known to be one of the symptoms of perimenopause and menopause, but that can, really come out through the voice. Other issues may also be more holistic. Joanne says, with some of the many changes being the changes to the quality of sleep, physical comfort and health, mental challenges such as depression and rage, and a lot of self-blame. So sometimes that can also cause us to then feel even worse about our voices because of all of these changes that are going on within our body. So there you have it. We have the main hormonal changes within the female voice. And thank you so much for joining me today, because it's something that I really feel passionate about, is about educating women, and especially women who have had their periods for a long time and have sort of been experiencing these changes and just thinking it's purely because they can't sing, or it's not it's all them, it's their fault. And also young girls coming through who are experiencing these changes and going, what? Singing was so easy for me before. Why is it suddenly so difficult? So if you've enjoyed this video, then hit the subscribe button. I'd love to see you around here more often. And if you want to learn how to sing with more stability and security, so that even through these vocal changes, you can sing with clear sailing and still have performances that just like rock the socks off your audience, then check out the link in the description below, because my vocal academy would love to see you, so you can get one-to-one personalized feedback on your singing, as well as weekly on-demand singing lessons. And we also meet up twice a month for live masterclasses, which is just amazing. And coming in 2025, we're going to be running group practice sessions, which there's just so much. It's all packed into the academy. I'll see you there. Check out my video up here on how you can increase your high notes straight away. And I'll see you around here next time. Have an awesome rest of the day, and happy singing. Ka kite anō.